And I'd also like to acknowledge the traditional owners of the lands from which others are joining this session from today as well, and pay our respects to elders past and present, and also extend that respect to any Aboriginal or Torres Strait Islander people who are here today. And I'd encourage you to share the lands as well that you're joining from in the chat as well, if you wish to do so. So my name is Dr. Van Laird. I'm based in the Prevention Research Collaboration at the University of Sydney, and I'm co-leading a programme of work in citizen science and prevention that's funded by the Australian Prevention Partnership Centre, which aims to embed citizen science approaches in policy and practice settings across Australia. So we host, as part of this work, we host this community of practice on citizen science and prevention, which brings together people from research, policy, practice and community settings who are interested in using or learning more about using a citizen science approach in chronic disease prevention. So it's a pleasure to welcome you to our second seminar as part of the community of practice. It's great to see so many of you here today. These seminars are really an opportunity to learn from others in this space about how they've applied a citizen science approach as part of their work to address key prevention challenges. And it's really meant to be a window into the experiences that our speakers have had with applying citizen science approaches, which is not often seen in a scientific paper. So we're really looking forward to today. If you are interested in finding out more about the community of practice, we'll share details on that and how you can become a member at the end of the session. I would like to acknowledge the Australian Prevention Partnership Centre who are funding the work that we're doing in the citizen science space, and particularly the Prevention Centre's funding partners who make this possible. And I would now like to introduce our speakers. So Brady Robards is a Senior Research Fellow at Monash University. Nick Cara is an Associate Professor in the School of Communication and Arts at the University of Queensland, and Sean O'Rourke is a Principal Programme Officer in the Alcohol and Tobacco team at Vic Health. And between them, they bring extensive expertise in research and policy in relation to social media, young people and unhealthy industry marketing. And in this session, they'll be discussing their experiences of using a citizen science approach to monitor unhealthy industry advertising to young people. So we're delighted to have you here today. Thank you for joining us. Just to note that in this session, we are recording. If you have any questions, we'll be using Slido, so please do add your questions to the Slido. Here's just the link there, and we'll add the details as well into the chat so that you have them there as well. So I'll stop sharing and hand over to you, Brady, Nick and Sean. Thank you so much for coming to speak to us today.
Thanks so much, Yvonne. Yeah, we're really pleased to be joining you. I'm going to speak first and then hand over to Sean and then Nick. I also want to acknowledge that I'm coming to you from the lands of the Wurundjeri people today of Kulin Nations, and I pay my respects to elders past and present, and extend that respect to any Aboriginal and Torres Strait Islander people who are joining us today. We are part of a much larger team, as you can see on our slide here, a huge team of researchers that have contributed to this project, and I want to thank all of them. I won't read out all of the names, but we've got a great team of people behind this project. The project is a partnership with Vic Health that Nick and I are leading from Monash and UQ. And it's been a really great, productive partnership. And I'll hand over to Sean shortly to talk a bit more about the context and where the project kind of started from in terms of Vic Health's motivations in commissioning the work. And broadly, to give everyone a bit of context, the project is on social media and what we've defined as unhealthy marketing. And in the project, we worked with 204 young Victorians to collect examples of advertising they saw on their own social media news feeds. And particularly the industries that we're interested in were alcohol, gambling or betting, and unhealthy food or fast food and sugary drinks. So those were our sort of three industries of interest, although we can talk more about our definitions of unhealthy industries, and Sean will talk about that in a moment. And basically, to give you the very short version of what we're going to talk about today, is we worked with 204 young Victorians to collect a really massive data set of more than 5,000 screenshots of advertising that they saw on social media over a week of data collection. that we staggered over several months, which I'll talk through shortly. And basically what we're going to talk about today is sort of how we did it, what sort of approach we took, and we're going to talk a bit about some of the challenges and opportunities that we see with the citizen science approach, which was quite fundamental to be able to do this work, but also borrowed a little bit from other traditions in the work that we do around participatory methods and informant-led research that Nick's going to talk about shortly as well. So to give us some context from the Vic Health end, I'll just hand over to Sean from Vic Health to talk a bit about why Vic Health commissioned this and what the context is there. Are you there, Sean? I haven't even checked to see that he's in here yet. We had a meeting just before.
I am here.
Oh, hey, Sean.
I failed at the unmuting. It's only 18 months into the pandemic and I still haven't quite got it right. But, by the end of this presentation, hopefully I'll be on top of it. So thanks for the introduction, Brady, and thanks everyone too for attending. It's exciting to be able to start talking about this project. I'm aware that we have a national audience today, so I'll just give a bit of background about Vic Health specifically and how we've arrived at this point. So Vic Health is a health promotion agency, and we were created under the Victorian Tobacco Act of 1987. And so, one of our very early achievements has been facilitating the buyout of tobacco sponsorship of sports and the arts. But over time, our role has expanded to include preventing poor health from other products like alcohol and junk food, also promoting mental well-being and social connection.
Oh, I think you got muted again, Sean.
Okay, I'm not sure what happened there. Can everyone hear me now?
Yeah, can you hear you now?
Great, okay. Anyway, I'll continue on. Okay. So basically, we've been involved in the, what we would term the harmful industry space for a long time, where we've been concerned about the activities of the tobacco industry, alcohol, gambling, and junk food. More recently, we've started to consider the tactics of these harmful industries a little more systematically. We recognise that countering their activities requires a thorough understanding of how they operate, as well as the impact of their operations. Within this, the other thing we need to start acknowledging, though, is the role of digital technology in making it easier and more affordable to promote, sell, and supply products to consumers that are harmful to health. Just last year, we released a report called Under the Radar with our partners, the Foundation for Alcohol Research and Education and the Obesity Policy Coalition, which explored the ways in which harmful industries can target their marketing to children and young people. And so it recognised quite a few things, but principally one thing that came out of that report for me was the fact that in many instances, children are seeing marketing targeted to them that isn't always visible to parents or other adults. In turn, this means that parents are less likely to see harmful digital marketing, let alone be able to do something about it, let alone being able to submit complaints to the relative or the right regulatory authorities. So from our perspective as Vic Health, we've recognised that we actually need to be able to start seeing the marketing that young people are exposed to from their perspectives. And this needs to be based on their use of social media, their web use, their browsing patterns, so that we can get a better understanding of the types of marketing they're exposed to, on what platforms this is occurring, and how this might relate to their use of social media and particular products, including alcohol, gambling products, or junk food. And so this is principally why we've turned to citizen science in particular, and more specifically to Nick and Brady and their colleagues from the University of Queensland and Monash University to work with young people aged 16 to 25 so that we can get a better understanding of these issues. So with that brief introduction and slight issues with the mute button, I'll now hand over to Nick to discuss in more detail why digital marketing is particularly challenging and the work they've done to engage a cohort of young citizen scientists in the project.
Thanks, Sean, and thanks, Brady, and everyone for joining us today. So I'm going to set the scene a little bit about what it means to try and study harmful industries marketing on digital platforms, what some of the issues are, and why a citizen science approach is so important in this kind of a space. Sorry, I can't remember if, I was on Sean's slide. I'm wondering why. I was like, why am I going to speak to that? Sorry, I was on the wrong slide. So we find that platforms like Facebook, Instagram, YouTube, TikTok, Snapchat, the platforms we kind of typically think of as the social media platforms, over the last decade have obtained extraordinary market power. If we think back to, just a decade ago, 2010, 2011, smartphone rapid uptake of the smartphone, Facebook had just launched as a public company, and really, if you go back and read the trade press at that time, a lot of people thought Facebook was on the verge of collapse, that it would not be able to build an advertising model that would work in apps and work on our phones. And it's kind of crazy to look back at that moment now and think, wow, that is not where we ended up. Like, this has been an extraordinary decade in terms of the transformation of how advertising works in our society, and an extraordinary decade in terms of the immense concentration of the advertising market really into two platforms and into ad markets. So Facebook and Instagram and Google and YouTube. Then you have these kind of insurgents. So Snapchat for a period 3 or 4 years ago was going to be the new big platform, and Facebook set out to acquire it first. And then when Snapchat wouldn't sell, Facebook set out to kill Snapchat's business model, and have done that pretty successfully. And then in the West, over the last couple of years, we've seen the rapid rise of TikTok. And again, Facebook trying to play a similar playbook to mute TikTok's growth. But TikTok's a different beast because it has a lot more funding. And so, there's a new kind of competition. But even so, we really are talking about 2, maybe 3 major platforms dominating the ad market. So that market power piece of it's really important, because we need to see these platforms as major institutional actors in harmful industries marketing. They're not just a neutral channel that the harmful industries use. They're in a very deep relationship with harmful industries, and they're a key part of their marketing apparatus. And I guess one of the paradoxes of this decade has been that at the moment where we and young people become much more visible to marketers than they ever have been before, marketing becomes almost entirely invisible to us, the public. And so they've built a form of advertising that's not just highly targeted and highly customized, but it's uniquely unavailable to forms of public scrutiny. And this is a major challenge, not just to researchers who want to study what kinds of marketing is happening, what kinds of advertising young people are seeing, but it's a major challenge to regulation, because nearly all the forms of advertising regulation and accountability we developed for the broadcast era were based on the principle of public scrutiny. So I just kind of want to frame that problem, and then when that begins to play out is, if you want to understand the kinds of alcohol, unhealthy food, or gambling marketing that are happening, you need to that are happening out there, that typically that advertising is only visible to the individuals those marketers are targeting. There's no public repository of it. And so the kind of citizen science or approaches like it become really important, because you need to go and work with people who are seeing this marketing and get them to show you what they are seeing. Maybe before I hand over to Brady, the other kind of point about a citizen science approach is that to us in our field, so Brady, colleagues in our project, and Brady as youth sociologists, other colleagues and me as coming out of a media and cultural studies background, there's a really rich tradition of what we would call participatory research approaches. And that is working with people in particular cultural contexts in a quite collaborative way to understand what their media cultural consumption practices are and how they make sense of them. And so the kind of citizen science we do builds on that participatory tradition. Okay, I think I'll hand over to Brady now for the next slide.
Thanks, Nick. So we've got some research questions on the next slide that we started with. I'm not going to go through all of these in a lot of detail, but essentially the project we designed, which I'll talk through in a moment, started with these questions. So Vic Health was very much interested in the kinds of covert and overt strategies that different industries were using to target young people, and they were interested in differences between industries and across different platforms, as Nick has described. there was a real core part of our project on the perceptions young people had towards these kinds of strategies. So what did young people make of them? Were they aware of the kinds of strategies that different industries were using to target them? What were their perceptions around the impact of them, and so on? We were also interested in getting a sense of whether the young people in our study and more generally were interested in change. Did they think that the platform should be operating differently, or that the industries using these platforms to reach them should be regulated in different kinds of ways? So they were some of the core interests in our study. And if we go to the next slide, Nick. So this is the study that we designed. So because of the nature of the research questions, they were both about uncovering specific kinds of strategies and approaches industries were taking, but also young people's perceptions and beliefs around these practices. We designed quite a complex mixed methods study. So the study involved both surveys, 2 surveys, and also a week of data collection where our participants, who we conceptualized in the design as citizen scientists, and for the purposes of this presentation, that's obviously quite key, but we didn't really use that language with them, and we'll talk more about that as we go. And this was informed by a lot of conversations we've had with the folks behind the evaluation of the study, including Yvonne, Leah, and Sam, in thinking about how to introduce young people to the idea of citizen science, or to introduce them to the study. But the project essentially had these 6 steps. And this was carried out over the first few months of this year, which I'll talk more about in a moment. We staggered it for a few reasons, but generally the project lifecycle looked like this. From recruitment, we used social media, of course, to recruit our participants. We ran a series of campaigns through Instagram and Facebook to attract volunteers to the study. And we had about 400 volunteers over the course of those campaigns. Step 2 was inviting. So from the volunteers, we selectively invited participants into a series of waves. And we did that iteratively in order to make sure that our group of participants was quite diverse. And while we can't talk through a lot of the findings just yet, we can say that the group was very diverse. There was a very even gender split. There was also a good split in terms of regional and metro participants, a spectrum of age participants, and so on. So once they were invited into the study, they commenced with the first step, or step 3 rather, which was survey 1. And in that survey, we did a bit of onboarding, introducing them to the idea of the project and sort of introducing them into the project team, essentially. And then we also asked them some questions in that first survey to establish some demographic profile, to understand their consumption patterns. So, whether they were alcohol consumers, did they gamble, what kind of food and drinks they were consuming, what sort of advertising they thought they saw. And then step 4 was whether rubber really hit the road. This was their data collection window. So with the 204 young people who participated in the study, all of them over a 1-week period, sometimes a little bit more, maybe 7 to 10 days, they were actually scrolling through their social media as they normally would and taking screenshots for us of images of advertising that they saw come up in their news feeds that fit into the parameters based on the training we did with them in survey 1. And then they were sending those screenshots to us via SMS. And we used a web-based platform called Message Media that allowed us to, as a team, be logged into kind of like a chat line, so that our participants could be messaging us throughout their week of data collection, asking us questions, sending us those screenshots, and also, importantly, allowing us to ask follow-up questions as well. And Nick can talk a little bit more about this in a moment. Step 5 then, at the end of their week or so of data collection, then they completed a second survey. So we would prompt them to do that via the SMS platform we were using. And that involved them sort of reflecting back on their week of data collection. And then we also asked some of the same questions that we did in survey 1 to see whether there had been a shift in perceptions around the kinds of marketing material that they had seen from those harmful industries we were interested in. Importantly, we also gave them a gift card to thank them for their time, because it was quite a significant ask in terms of 2 surveys, a week of data collection, regular SMS chat over that week. We gave them a $100 gift card. And this was to a retailer of their choice. We use a website called Prezi to do that. And this was obviously a really key motivator in both volunteering, but then in actually participating. And we talked a lot about, the level of remuneration there, and that's something that we would be happy to discuss with this group as well. And then the final step, which was optional, was a focus group discussion forum, and we used a platform called Focus Group IT, where we invited participants back in a little while after they had completed their data collection in order to sort of reflect, check the analysis that we had done on the images they had sent us, and to report back, essentially, to invite them back into that analysis phase of the work with us. So I'm sorry that I've rushed through that. We're going to flesh out some of these steps as we go. This next slide describes the various waves. So we divided the project up into these waves because, first of all, we wanted to just pilot to see how it went with a small group. In wave 1, we had 25 people. That was in February. And of those 25 that we invited in, 20 continued with the first survey. Then 20 also completed. So we had 100% go from the onboarding in step 3 to finishing the project with us in step 5. And then you can see we sort of amped it up for wave 2, 3, and 4. So we're inviting up to 100 people into wave 3 and 4 by then. And we still had pretty good retention. So a few people dropped off between invitation and completing the onboarding survey. So they saw what was involved and maybe they thought, okay, this isn't for me, because it's quite a lot of work. But once they were onboarded in terms of finishing survey 1, we had 85 to 100% retention, I suppose, over that period. And we can chalk that up to a range of reasons. I think the SMS chat was really vital in terms of us staying in touch with them, reminding them what we were expecting of them, and they could also ask us questions if there were things they weren't sure about. So that helped us kind of stay in touch with them. And Nick can maybe talk more about this, but one of the values of the SMS approach was that, we weren't asking them to download a whole other app or to talk to us in a space where they weren't spending time. Everyone has, or all of our participants had mobile phones that allowed them to SMS, and they were very familiar with the practice of screenshotting. So we kind of met them in the places they were and with the technologies that they were familiar with and the kind of processes and cultural practices that they engage with in an everyday sense with their own friends and networks. So that was one of the values of the SMS, text messaging, rather than asking them to download another app or have some sort of bespoke platform. We were kind of talking to them in the spaces they were in. The focus group discussion forum is probably one that we can talk a bit more about. The reason why we added this in, even though we didn't have a huge uptake here, only about 15% of our overall cohort signed up, and then only about 26 eventually actually commented on and contributed to that discussion forum. Because we were taking a citizen science approach, we were really conscious about sort of closing the loop and giving our participants an opportunity to come back and reconnect with the project after their data collection in terms of working with us on the analysis. In some ways it was successful, but actually we found that the SMS chat as a space to reflect and kind of engage and go back and forward was much more productive. So I don't think that the focus group discussion forum idea was necessarily a failure, but it was obviously the uptake wasn't as big as the SMS chat. So we can maybe reflect a bit more on that. But yeah, if you want to go to the next one, Nick. This just gives you a very quick insight into the amount of messages. So we sent from our account about 2,000 messages, and this was split up amongst a team of maybe 5 or 6 of us that we shared the work over the 4 waves. And there was usually 1 or 2 people who were sort of consistently in there during business hours for the chat line. We had, as I said before, between 20 and sort of 80 people in each week. So there was quite a lot of activity, but we're also receiving a lot of material. So this was both just images being sent to us, but also questions and them answering questions from us and kind of a dialogue back and forward. I'll hand over to you, Nick, to go into this a bit more.
Thanks, Brady. Yeah, so maybe just to pick up where Brady left off, the SMSs were really an important part of the method because they made it a much more collaborative conversational engagement over the course of the week. We think that really helped in terms of retention of participants. So I think that's why once they'd done survey one, they stuck with us. Part of the reason was the SMS chat, but I think it also helped kind of construct the, I don't know, culture of collaboration in the project. And I also think the immediacy was really important. So, they're super familiar with texting and screenshotting, but also if they screenshotted something, they could then just SMS it to us straight away. It wasn't like they had to go back looking at the end of the week for all of their data they collected for us. They just keep on sending it to us. And when they send us stuff, we'd say thanks or whatever. But oftentimes too, we get into quite rich conversations with them. And I'll talk about that in a second, but I'll kind of cycle back a little bit and say that to just sort of talk through a little bit more what and how we worked with people once they were on board. So when the participants did survey number one, we had a series of videos that walked them through, I guess, our research project. We were kind of saying, this is the research problem that we're thinking about, and this is why it matters. And we were trying to kind of develop their interest in it and involve them immediately in the project as people who are trying to think about this problem with us, rather than just say as sources of data in our project. And then we also, these videos, we had 3 of them, one that was really setting the scene, and then 2 that kind of took them through what it was we wanted them to look for, how to screenshot it, what to send to us, and one that was quite a difficult thing we asked them to do, which was to go and download your Facebook ad preferences data, which is this data about all the information Facebook keeps about you and plugs into their advertising model, but Facebook make it really difficult for you to download. So we had videos that sort of walk them through things we wanted them to do for us. I think I've got time to show you a minute of one of those videos just to give you a feel for the project and how we set it up. So I'm just going to clip out and jump over to YouTube for a second.
So we know that when it comes to alcohol, gambling, unhealthy food and drink, advertisers love to target young people, that is, people under the age of 25, because we're in the process of building patterns of consumption that will last us for the rest of our lives. Because these products affect our well-being, it's important to know how marketers are using digital media and whether we need to create rules that encourage healthy patterns of consumption early on in our lives. Researching and regulating these sorts of ads is really tough because the sorts of ads that you see on Instagram, TikTok, Facebook, and other digital media are increasingly difficult to spot from the outside. You see, digital media collect information about us, who we are, what we like, and use that to target highly personalized ads at us. Many ad campaigns are also brief and ephemeral, that is, blink and you'll miss it type stuff. Take Instagram stories, for example. You and the other people the advertiser is targeting see it, and then it disappears. Sometimes it's hard to even know if you're being shown an ad at all. Lots of ads are super subtle and informal, like an influencer posing with a couple of beers, or the sponsored Snapchat filter your mates have been using. The point is, digital marketing is a bit of a black box.
All right, and I'm going to pause it there and come back to the slides just a second. Sorry, my... All right, back to the slides. So that was Lillian, who was one of the researchers on the project working with us, and a part of one of a series of videos she made, very much from a kind of peer-to-peer perspective, talking about what it was we were interested in this project and asking people to think about it with us. And the setup then was to say, only you can see the stuff that we're looking for because it only shows up in your feed. So this is what we're looking for. When you see it, can you send it to us? And then as you send it to us, we're going to chat back with you and ask you to help us make sense of it. So you're both like a source of the information because only you can find it, but you're also the person who understands where you saw it, why you see it, what the patterns are like. And we were getting to quite rich conversations with our participants. As they began to notice patterns, like I'm noticing, that nightclubs start sending me stuff on like Thursday afternoon, and then I get a real run of that stuff through the weekends. Or some young men would notice the way that sports betting would target around the teams that they were following or whatever it might be. So they would have their own kind of, like they could join the dots with us because they knew things about their own life that we didn't know, and they could kind of make sense of the patterns in the context of their own identities. And so this kind of process during the week was like a really important part. It was the heart for me of the citizen science. We asked participants to send us 10 screenshots. On average, we got just over 20, but some participants got right into it and sent us more than 100. And I think many participants we spoke to sort of said there's really, I could have sat here all week and sent you 100 images a day, do you know? Whereas some said, I hardly saw anything. And we found that really interesting. There's clearly ways in which the model is tuned to target some young people more than others. I think I've said, yeah, I've kind of the SMS thing we've talked about a fair bit. And I think that what emerged as we went along over the course of the week is that this chat was really important. And maybe one of the thing I'd add there is that we kind of assigned, groups of 10 to 20 participants to an individual. So I had the 10 or 20 that I was working with for that week, and Brady had his group, and Lillian had her group, and Kiara had her group. And that created a kind of rapport between a researcher and participant that became like a conversation as the week went along. I think in the interest of time, I should hand back to you, Brady, for this next bit.
Yes, I can talk to this. I was going to talk to slide 11. Yeah, we can skip to the citizen science.
Oh, wait, should I talk a little bit about, I think we should say one or two things here. Sorry, I can pick this
up. You talk about that.
Sorry,
you talk about that. We're very organized.
We've talked a little bit, I guess we've put a lot of emphasis on the onboarding and the SMS chatting as key to kind of keeping people engaged over the course of the week. But we also, we noticed we had a really low attrition rate once participants were onboarded. And I think there were two things there. One was like onboarding in survey 1 was a kind of lot of work, and we put it up front. Like, this is what's going to be involved. So people kind of had a clear idea of what the deal would be if they were going to work with us as citizen scientists for a week. But also we had like an honorarium we paid. We paid $100 for them to go through the whole process, and that was paid at the very end of the week. And I think when we talked to them, that it was a mixture of really kind of getting super interested as they went along. Like in our chats, people would say things like, that you could see them getting really interested in the patterns they were seeing as they trying to discuss them with us. But also I think, of course, the cash incentive was an important piece of it. And I guess the way Brady and I and others in the project thought about this piece of it as well is that it's not just an incentive to get people to participate. It's actually part of the ethics of a participatory approach for me, that if you're going to value people's expertise, and if you're going to treat them as if they're researchers on the project, then you should pay, in a sense, if you can. So I feel this is an important piece of it, that when you ask people to do things that are about their expertise and their know-how and their knowledge, that you acknowledge the value of what they can do. That's probably the only point I wanted to make there. So we can go to slide 11 now, I think, Brady.
Yeah, no, that's good, Nick. And I think just to dwell a bit on the point before about the SMS chats, I think, yeah, I agree. Like, I guess when we were designing the project, we didn't think the SMS chats would be as rich as they ended up being. We were kind of imagining the SMS chat as just a way for them to send us the screenshots. But I think we realized early on, this is a great opportunity to actually engage them, to invite them to reflect, to get them to, explain what they thought they were seeing. And the more we thought about a citizen science approach, the more that became quite vital, I think, in understanding the material that they were sending us and contextualizing it. So as Nick sort of indicated, we in the past have taken a sort of participant-led, participatory kind of research approach in many of the other work we've done. But prior to this project, we hadn't before used the language of citizen science, not to kind of out ourselves as imposters here. But we're really interested in connecting with this group, I think, because the kind of formalization of citizen science was something that we've actually found quite useful and productive in designing this study. And so what I've done here is just listed out the 10 principles of citizen science that I found from the Australian Citizen Science Association website, and started to reflect in the column on the right whether or not we actually lived up to these principles and achieved these principles in the work that we had done. And maybe I've been a bit too honest here in some of these reflections, but this is why we wanted to engage with this group, and also why we've found the collaboration with Sam and Yvonne and Leah so productive as well, because we've found this quite useful in terms of pushing us forward, I think, with some approaches that we've taken in the past around participatory methods and informant-led research. This kind of pushes us to the next level. So just in the last few minutes, we wanted to reflect on some of these principles. So the first principle that was here was around actively involving citizens, kind of the obvious one in the scientific endeavor. In scientific endeavor, citizens act as contributors, collaborators, or as a project leader. And I think that mostly we did achieve this in terms of contribution and collaboration, at least, to the point that this would not have been possible without the kind of data collection that our participants, our citizen scientists, engaged with. As Nick said at the beginning, this isn't the kind of project where you can study, ads on television during sports or go around and study billboards or something. We literally can't see these ads that are being directed at young people. Everyone has a different kind of news feed that's algorithmically generated based on your demographics and your interests. So it would have been impossible to do this work without the data collected by our participants. The question about incorporating, citizen scientists, or in our case, young people as project leaders, is something that we didn't have the scope to do, but I think has prompted me to think more about how we might do this in an ethical way in the future, in terms of paying them for their contributions. And I think that's something that we have, youth advisory groups and in other projects, and I think that's useful to a certain point, but how to engage young people as like core to the research and to pay them for their time, I think that's quite crucial for us. The second one here was around genuine science outcomes, for example, mapping projects to research questions, which certainly we did. And we hope that this will have some kind of policy implication as well, and Sean might be able to reflect on this shortly. The third one was around benefits to both science and society. And certainly we definitely have these sort of academic outcomes. Our report for Vic Health, we hope will go some way to having some kind of policy impact. But we also think that there was a function here about the way that our young participants, our citizen scientists, develop their own kind of literacies. And one thing that we're going to talk more about in future publications is about the impact of the data collection week had on some of their views and perceptions around the volume of ads, whether there should be more regulation and these sorts of things. So definitely there was this kind of process of critical reflection and development of literacies and awarenesses of some of the material that they were engaging in. The fourth one was about the various stages of the scientific process, and apologies that this is a wall of text and some of you might not be able to see this very clearly, but I think this is one where, again, in terms of the design, how to build citizen scientists into the very early stages while also, remunerating them for their time and acknowledging that this would be quite a big ask. And I'd be keen to hear from others in this group about how to do this in an ethical way. And that's something that I think we are still working on in terms of also how we communicate the results, how do we involve our participants in that process. The fifth one was about citizen scientists receive feedback from the project. And that was really one of the aims of that focus group discussion forum that we ran that wasn't taken up very well. But it was an opportunity for them to re-engage with the project, and we might think about ways we could do that better in the future. Nick, I don't know if you want to go through the last 5.
Yeah, sure, Brady. I might, I'm just conscious of the time, so I might just kind of zoom in on a couple of issues in that final 5, but about sort of how results of findings of the study are made publicly available and how citizen scientists are acknowledged. And I think there's sort of, I don't know, micro and macro ways of doing that. So I feel like in a lot of our SMS chats, citizen scientists have really interesting questions for us, like, why do you think I'm seeing this? Or what does this pattern look like to you? And so we kind of say, like, well, from our point of view as researchers, this is what we know about how these ad models work. And they go, oh yeah, that begins to make sense. So there was a kind of, I guess, a process of like making sense of things together. And I think there was a benefit there that many of them engaged with. But then of course but then there's that larger macro piece of it, which is like when we publish the study, both acknowledging their participation, but also making those results available to them. And something that we're not, that I think we will think about a little bit more, maybe in this project, but certainly in future projects, is just like the videos we made at the start. Do you need that kind of engagement at the end, which is thinking about how you present your work and engage with the people who participated in it. But I think because we're coming up to 12:40, I should hand over to Sean to wrap us up.
Thanks, Nick, and thanks, Brady. So I prepared obviously some points prior to this talk to discuss, and then as you go through all of those points, just more things kind of occur to me that we could try and do. but I'll try and be a little more succinct rather than reflect on my current thoughts. But looking at the volume of information that you've been able to collect in the project, the first thing that comes to mind for me and for our work at Vic Health is how we can feed this into the kind of surveillance and monitoring of harmful industries that we're already doing. As far as I'm aware, like there have been some other studies in this space, but I don't know that, digital marketing by harmful industries has been as exhaustively detailed before. So I think it will really be crucial to developing our understanding of how harmful industries operate in this space. And that's something, of course, we'll also work with partners on so that we have a shared and continually developing understanding of these issues. The second point I'm thinking about increasingly, and it's something we'll be able to turn to as we, see the final results of the study, that is how we can, I guess, use those results to push for better health protections, particularly around young people. So we might have all of this data that shows the many ways in which young people can be targeted by harmful industries. But it's in ways that's often not apparent to the broader population or to parents, as both Nick and Brady have illustrated. Most of you might not be aware, or some of you would be, but across different states and federally, we have various marketing regulation, which are really complaints-based mechanisms. And so they rely on someone, first of all, seeing digital marketing, then recognizing that it's harmful in some way, and then being in a position and being willing to actually submit a complaint and go through a process. And I think when we're talking about this highly targeted and non-transparent data, a process like that, frankly, is not set up to be as effective as it could be. So there's, I think, a role for both Vic Health, other partners, but also policy and decision makers to start thinking about what a more up-to-date or, current, but also reflexive regulatory system might look like so that we can better protect people from the harmful impacts of digital marketing for products like alcohol, gambling, junk food. And lastly, or kind of lastly, I think I have a couple more points. There needs to be some kind of work done at a more general population level, I think, around awareness raising. Obviously, young people in particular are more digitally literate, but I think there's still low levels of awareness of, one, how harmful industries operate in terms of digital marketing and the different way in which consumers are targeted by that digital marketing. And I saw a comment in the chat pop up before, and I tend to agree that there is probably also a broader digital literacy piece that needs to be done somewhere down the track as well. The final point, the final last point that I'll make is that I think this overwhelmingly validates citizen science as an approach. And so there's an opportunity for us to consider how we can continue to use it, but also how we can advocate for its use in other settings or in other organisations, or arguably closer to the policy-making process. Building off what Brady said before in the previous slide too, I wonder how Vic Health and others can also help support young people to be those active citizen scientists as well, in a way in which they get credit for participation that goes toward their own career development and things like that. And possibly there's a specific role for public health agencies and others to play in that process. But those are sort of my main reflections on how this research can be used. So unless Nick and Brady have any further comments, I might hand back to the group.
I'm happy. I think hand back to the group for some questions. Thanks, Sean.
Brilliant. Thanks very much, Sean, Nick and Brady. That was a really exciting talk. It was great to hear it all together. And we have got some questions that have come through in Slido. So maybe I'll just start with the first one that came through, which is from Dr. Anne Lawless. And Anne's asking what kind of ethics issues came up for you as researchers in scrutinizing the social media. So what kind of ethics challenges you might have had to come across with Brady or Nick? I don't know if one of you want to kick off.
Yeah, I think, do you want me to go first, Nick?
Yeah, I think so.
I think it's a good question. I think ethics is challenging here in a few different ways. I won't talk so much about the ethics committee kind of clearance process. That's maybe a different issue. But I think one of the key challenges for us is around anonymizing some of the material. So a lot of the times, screenshots will be sent where their friends are maybe incorporated, and this is a major challenge for us because friends of the participants don't sign up. They don't provide informed consent to be involved in the project. So if someone sends us a screenshot of a Instagram story or a Snapchat that was maybe only intended to be seen by a very small number of people, and then suddenly it's included in a research project as a piece of material. So we obviously go through a process of anonymizing any usernames or faces, or even location stamps, those sorts of things before anything like that is included. But there's one level of ethics of including screenshots from KFC or some kind of sports betting ad, but then it's another thing do we include images of everyday people that are maybe holding a drink or sharing something and their name is included in it. So that level of kind of detail, I think, is part of it. I guess some of the other ethics challenges we have are really around the question of, harm versus value. So, the time that it takes for someone to do this as part of their normal process. That's quite a big ask. And so we're always conscious of that. And that was one of the reasons for the gift card being $100. But the other one that's quite slippery that we've started reflecting on is what the impact of doing this data collecting and hovering over ads does to our participants' own algorithms in terms of what ads then are centered. And so a lot of our participants talked about seeing more ads for these harmful industries. And whether that's because we asked them to do that and so they're more aware of it, or the algorithm has actually changed and reconfigured to privilege those sorts of ads because they're engaging with them by hovering over them, by screenshotting them. Nick, I don't know if you want to reflect on that. Like, do you think that this is more about perception, or is there an algorithmic reality to this?
Yeah, thanks, Brady. I agree that there's not a lot of ethics issues in this project with the content. If we're asking people to send us more like user-generated promotion, where their friends are kind of posting about their own nightlife or whatever, then that's much more ethically complicated. But yeah, there is something going on here. And I know like from other, I know of an example of another research project where they used Facebook Messenger as their platform to communicate. And it's like that really did trick the ad model off, tip the ad model off, like, oh, these people are really interested in alcohol, and then starts to tune the feed that way. And so people pausing or engaging with the ads in order to screenshot them, it is a piece of the feedback puzzle in the platform. And I think it's definitely an ethical issue for us to think about. And I guess the way we handled it in the project was really like reflecting on that with our participants as they noticed it, and we discussed it with each other.
Thank you. Another question we have is around addressing inclusiveness and ethnic and racial disparity in your recruitment.
Yeah, that's a great question as well. We did make a lot of efforts to recruit quite a diverse sample in terms of gender, sexuality, location. Did we ask about race and ethnicity, Nick? I'm just trying to remember about this in the survey.
We definitely asked it we asked questions about speaking languages other than English at home. So we asked diversity questions, but I don't think we recruited directly for it.
No,
but we definitely noticed diversity in the sample. Like it was, we would notice often just as participants SMS things in, like I wouldn't know their age, gender, ethnicity on the chat line, but just looking at the images they sent, it was obvious that the Facebook advertisers knew what their ethnicity was, we really did notice that diversity when we were chatting to people in terms of age, sexuality, gender, and ethnicity, just because of the kinds of ads they were sending us.
Yeah, and then the follow-up question from Anne there about we definitely had a representative group in terms of Aboriginal and Torres Strait Islander participants. We haven't looked specifically at that group in terms of the question on gambling, but yeah, just to kind of back up what Nick said, we definitely had a diverse group in terms of the kind of way that the platforms were seeing them, I suppose, and in terms of language, in terms of kind of names and the kind of conversations we had with people. But it's a good point. In another project that I've done since then, I've left a kind of open-ended field in demographic questions about how they think about their own race and ethnicity, and kind of thinking about that complexity is not always easy to capture in survey research. But I think that's something that in retrospect, I would probably do a bit more of. That's a really good question. So yeah, thank you for that.
Thank you. And this might be one for Sean to start with. Someone has asked, what actions do you think are possible to protect young people in the digital space?
It's a very big question. Look, I think going back to the point before, I think we do need more responsive and reflexive regulatory measures. I'm not too sure what that looks like in the interim, but certainly, you know, in terms of alcohol and gambling, some of the regulations are overseen partially by the industry and industry bods. So I think a good first step is probably, you know, advocating for the removal of, you know, conflicted stakeholders in the regulation of the products that they're marketing. But more broadly, there's probably a piece at, you know, looking at the ethics of targeted advertising in particular, and how we can better protect consumers in that sense. And then a broader discussion too about the exposure question. But I think these are things that we're all kind of collectively grappling with at the moment, and trying to look at the opportunities at both the federal and state level. Adding onto this too, I'm aware that, you know, there might be future possibilities around AI, or another alternative could be about using consumer panels built off research like this to better inform regulatory systems. So I guess governments and decision makers are actually more exposed to what people are seeing rather than relying on current complaints-based mechanisms.
Great, thanks, Sean. Nick or Brady, did you want to add anything?
I guess, yeah, I have a view that the advertising model of these platforms is harmful. There's no, if you have an ad model that's based on learning people's preferences and tuning toward it, there's really for addictive commodities, there's no not harmful version of that. And I think that part of what a study like ours is trying to do is show not just the volume and content of this kind of advertising, but those patterns of who gets it and why, and how it's very how certain kinds of marketing are very concentrated toward particular kinds of consumers. And I think that's a really important piece of it for us as researchers, that we're not just looking at volume and content, but we're looking at those, you know, the way that the data-driven aspect of it really targets people. And then I think it raises new kinds of regulatory challenges for us. Yeah.
Thanks, Nick. Someone else has asked, were you satisfied with the data, and were there any instances of marketing that were new or surprising to you?
I'd just jump in and say yes. we were satisfied. Yeah, satisfied is a funny word, but we were like, the data is so rich and they sent so much of it. Like it was, we asked for 10, we thought we might get 2,000 examples of ads. We got over 5,000. And the quality of it was extraordinary in terms of the range of stuff we got sent. And we have learned really surprisingly new things about what advertising on these platforms looks like. And it makes me realize, in a sense, that in a lot of our research and public discussion, we've paid a lot of attention to the forms of advertising on these platforms that are more public, and we haven't paid attention to the dark and below the line forms of advertising because they simply haven't been visible to us. But I really feel in this study, we're able to provide a portrait of that dark below the line advertising, which is actually the majority of what's going on. And so, yeah, we have learned some really interesting new things and new patterns that we weren't aware of before.
Brilliant. And then building on that, Catherine has also asked, did you see any e-cigarette ads, or were they out of scope?
Yeah, they were out of scope in terms of the industries we were interested in, but from memory, I don't remember seeing any. Nick, did you see any in the ad coding?
I don't think we did. We saw a few. I don't know if we saw e-cigs. I can't remember. We saw a few, of those other harmful commodities, but weren't the ones we were specifically asking them to look for. But I think that the reason for that is we said very narrowly, like we had a bit of a debate at the start of the project. We let our participants decide what's unhealthy, and we thought we might get, diet stuff and skinny teas and all of these kind of things, but we decided just to keep the project focused on these three commodities: alcohol, unhealthy food, and gambling. And I think it would be another study to go and look at, other kinds of harmful industries marketing. And I think this method is transferable to those other examples.
Yeah, absolutely. I think lots of opportunities in this space to expand what you've done to other topics and areas. I can see someone else in the chat has also asked around including free to air television advertising as well. Okay, I think given the time, we probably have time for maybe one final quick question. I've got one more here. I've got a couple more, and maybe what I'll ask you to do is, if you wouldn't mind answering the last couple of questions, then I can send that by email. But someone else has asked, is it unrealistic to think we will one day work with them for other major health issues? I'm not sure who's been referred to as them though in the question. I don't know if the person who asked that question is able to jump on and clarify.
They mean the Casey means the Facebook.
All right. Okay.
Yeah, I think it's a good question about at the moment my view of it is that Facebook's been unbelievably bad at filtering and removing misinformation related to the pandemic. I think where they've made minimal efforts to do so, it's under enormous public scrutiny and pressure. So unless there are serious levers that force the platforms to properly regulate flows of content on their platform, it is still effectively the Wild West. That's my view of it. I don't think the platforms would work with us of their own accord. It'd have to be because someone makes them do it and sets the terms on how they do it.
Yeah. Brilliant. Okay. Well, thanks much again for coming to speak to us. Just before people jump off, I wondered, Leah's just put a link in the chat as well, but I wondered if you could fill in a quick feedback survey for us. Hopefully you can, I don't think you can see my correct screen. Let me try again. Great. Yeah, so hopefully you could fill in a quick feedback survey for us and let us know how you found the session. But yeah, thanks again, Brady, Nick and Sean. That was such an interesting presentation and so nice to hear it all come together and to see you at this point. I think there's lots of learnings as well that you've shared for people on this session as well. So thank you very much. And thanks everyone for joining.
Thank you.
Thanks everyone.
Thanks everyone.
Thanks so much.
Thank you.